Assalamu alaikum wa rahmatullahi wa barakatuhu. Bismillahir Rahmanir Rahim. Today I would like to discuss about the diabetic patients and their nutrition during Ramadan. Diabetic patients are at a higher risk of developing complications during Ramadan if they are not assessed properly and if they are not following proper advice. Therefore, I would like to enhance your thoughts about diabetics and nutrition during Ramadan. There are three main aspects to be considered in this discussion. One of the aspects is the diet, another aspect is the drugs, and another aspect is daily activities. They are the 3 Ds of management of diabetics during Ramadan. Let me first consider the first D, the drugs. Before coming to the drugs, we should have a background knowledge about the diabetic patients. Basically, there are 2 types of diabetic patients. They are type 1 diabetic patients and type 2 diabetic patients. With regard to type 1 diabetic patients, most of the medical experts, almost all the medical experts say that it is not recommended for them to fast because they have no insulin at all. They are totally dependent on exogenous insulin, that is the insulin which they get from as a drug. Therefore, it is not recommended for the type 1 diabetic patient to fast. If they fast, there is a high risk of developing adverse effects such as hyperglycemia, dehydration, ketoacidosis and thrombosis. These are medical terms which I would explain little later. But if a type 1 diabetic patient insists on fasting, he should prepare for fasting much prior to the Ramadan month. The month of Ramadan, he cannot adjust to fasting if he starts preparing only during the month of Ramadan. If he really wants to fast, he should go through an expert panel and expert advice before Ramadan, and there should be pre-Ramadan counseling and there should be pre-Ramadan total assessment of the patient. Therefore, I should not consider type 1 diabetic patients in this discussion. Among the diabetic patients, most of them are type 2 diabetes mellitus patients. Therefore, we'll discuss that in a little greater detail. In fact, type 2 diabetic mellitus people can fast with proper advice and proper drug and diet management. Type 2 diabetic patients are of 2 varieties. One group of patients, they are only on oral hypoglycemics. That is, they use only tablets such as metformin, gliclazide, carbose and other oral drugs. And there's another set of patients, a minority of the patients who are on insulin plus oral hypoglycemic agents. In that variety, it is like the type 1 diabetic mellitus patients. There is a risk of developing the complications. A patient whose diabetic control is good before Ramadan most probably have a very good Ramadan without any complications. If a patient's pre-Ramadan diabetic control is poor, then there is a high chance that he will develop complications. A patient who is solely on diabetic counseling without any drugs, that is, if he is on an impaired fasting glucose level or a pre-diabetic, he can fast and that will be really helpful for him. During Ramadan, he can really come to near normal glycemia and his condition can improve. The next group of patients who are on oral hypoglycemics and well controlled. If the patient is on tablets and his diabetic is well controlled and without any complications, he can also have a very good healthy Ramadan without any complication, and his diabetic condition also will improve during Ramadan. But if a patient's control is poor with drugs or insulin, there is a high chance that he will develop risk factors. He will get complications. Complications are of 2 types. There are acute complications and long-term complications. The immediate complications are hyperglycemia, hypoglycemia and dehydration. Basically, these are the complications. That is, hypoglycemia meaning sudden reduction of blood glucose levels below normal levels. That is, the glucose level below 60 milligram is considered as hypoglycemia. And in some patients, the complication is hyperglycemia, that is, the sugar levels are more than the normal levels. Generally, it is more than 300. And dehydration is also another complication partly related to hyperglycemia. Long-term complications are many, and they can affect small vessels and large vessels. That is, microvascular complications and macrovascular complications, and they can affect any organs of the body, basically eyes, kidneys, brain, and the heart. Now let me consider in detail about the drug management of type 2 diabetics during Ramadan. If a patient's diabetic is well controlled with oral hypoglycemics, there is no need to change his routine tablets. Suppose if a patient is taking 2 times oral hypoglycemics, he can very well control with the same dosage. But if he is on a 3 times daily dosage, the dosage should be assessed and it should be customized to the patient. Generally, the recommendation is 1/3 of the dose in early morning and 2/3 after iftar. This is the general recommendation, but there is the large amount of individual variations. When it comes to drugs like metformin, the complications of hypoglycemia are less. But if it is a drug like glibenclamide, that is sulfonylureas and insulin, the complications are more, and it should be an individual assessment with their family doctor or their physician or an endocrinologist in severe cases before Ramadan or during Ramadan. We see some patients, they skip their morning dose totally. This is not correct, because they are not seeking any medical advice and they are doing their management on their own. They are at a high risk of hyperglycemia, and it should be prevented, that they should seek medical advice. Dose reduction should be done for the sahar meal, because after the sahar meal there is a prolonged fasting for about 14 hours. Therefore, the morning dose should be reduced. How much should be reduced? It is an individual question, but generally the reduction is 1/3. That is, if a patient is on insulin, if he is taking 60 units for the whole day, and 20 units should be given in the early morning and 40 units should be given at night. This is a general rule, but it should be individual management when it comes to the patient's total care. And there are patients who are taking 3 times daily regimen of insulin, and they should be assessed by their endocrinologist before Ramadan if they want to have a healthy Ramadan. Patients who are on sulfonylureas, those drugs which have insulin-like effects, such as glibenclamide, they can take half dosage in the morning, and they can take a double dosage at night if they are eating well. But again, I would like to stress the drug management is highly individualized, and the patient should seek the doctor's advice during Ramadan and before Ramadan, and he should have an overall idea about himself and his management of diabetes. The patient should know to recognize the hypoglycemic and hyperglycemic symptoms. The hypoglycemic symptoms are sweating, faintishness, palpitations, anxiety, and confusion are symptoms of low glucose levels. And if they recognize those symptoms, they should immediately check their blood glucose levels and break the fast. And generally their blood glucose levels are below 60 when they recognize their symptoms. And if the patients are capable to recognize this, they can break their fast. And there is no contraindication to check their blood glucose levels during fasting. The hyperglycemic symptoms are excessive thirst, excessive urination, and again disorientation and confusion are symptoms of hyperglycemia. Therefore, if the patient has such symptoms, he should also break the fast. In some patients who are diabetic for a long time, they lose this hypoglycemic awareness. In such patients, they will not recognize when the symptoms when their blood glucose levels go below normal levels. In such case, they should not fast. Regarding pregnancy, pregnancy itself is a risk factor for fasting. If the pregnant woman has diabetic, that is called gestational diabetes, then she should not fast because it is a risk for her as well as the baby. Now let us discuss about the diet management of the diabetic patients during Ramadan. During Ramadan, whether it is a diabetic or a non-diabetic, they should not skip suhoor. But it is particularly important that a diabetic patient should have a proper diet during sahar. And they can start with their normal meal. They can have a morning milk tea if they are taking without sugar or very less sugar. And they can have a full glass of water. Then they can have their sahar meal. Sahar meal should be of complex carbohydrates. The carbohydrates should be of complex carbohydrates which have low glycemic index. The glycemic index measures how a carbohydrate containing food raises blood glucose. Foods are ranked based on their glycemic index. So therefore, the diabetic patient should know which food are the low glycemic index foods. Low to moderate glycemic index food are red rice, basmati rice, oatmeals, pasta, non-starchy vegetables, most of the fruits, barley. These are the foods which are of low glycemic index and moderate glycemic index. Foods which have high glycemic index are sugar, white bread, white rice, cornflakes, and potato, pumpkin, melons and pineapples. They have high index, that is high glycemic index, and should be avoided or minimized for a diabetic patient. If they are to take a high glycemic index food, it should be always combined with a low glycemic index food. Glycemic index of the food is affected by various factors such as ripeness of a fruit. If the fruit is more ripened, the glycemic index is high. And the cooking methods. A baked potato has lower glycemic index than a mashed potato. And a storage time. If a fruit is stored for a long time, then there is a high chance that there is high glycemic index of that particular food. And the processing. If a food is processed, such as juice, fruit juice, they have high glycemic index, and all these foods should be avoided in a diabetic. Especially these foods are unhealthy when it comes to a diabetic. Diabetic meal should not only include the cereals. Cereals should only part of the diet. Cereals should include only half of the plate, and rest of the plate should be of good quality, complex vegetables which has a lot of fiber, and they should include fruit as well. As I said again, the fruit should be unripened, and some fruits have a high glycemic index such as watermelon, pineapple and ripe banana. But they can take fruits. There is no hard and fast rules. They can consume fruits because it has more good effects as well. Fruits have a lot of fiber. It has water, minerals and vitamins. Therefore, food should be part of their meal. And again, they should have a good protein source, high quality protein source in the form of meat or fish or egg. They should have some protein source in their food as well. So their morning meal, the sahar meal, should include all the variety of the food. And they should not forget, they should take a lot of water. At least 750 milliliter of water to 1 liter of water should be consumed during sahar time to prevent dehydration at a later time. Some people ask whether they can consume milk or curd or yogurt during sahar time. Of course, yes, they can take curd, but it is not advisable to add sugar or salt to curd. They can take curd, there is no problem, as long as they do a little bit of low to moderate activity in the morning as well. When it comes to iftar, it is a time after a prolonged fasting. After a prolonged fasting, having a large meal is not advisable because it will give a large glycemic load to the patient and which is not healthy. Therefore, the patient should start the breaking fast, that is iftar, with a water and a glass of milk and 1 to 3 dates. A simple iftar, and after the prayers he can have a normal meal. If he wish, he can have a normal rice and curry as I explained as in sahar, or he can consume the kanji. Short eats such as patties, Chinese rolls, samosa, pizza, burgers are not advisable for the diabetic patient. These foods have lot of trans fat and saturated fat and high amount of salt. Therefore, they should refrain from eating short eats, and also they should refrain from taking faludas and soft drinks which contain lot of sugar. At least 1 liter of water should be consumed between iftar and suhoor. That means the total daily intake of water should be no less than 2 liters. After night prayers, they can have a late night snack. A late night snack is preferred in diabetics, and that should be of very light meal and complex carbohydrates or a mixed fruit without sugar or salt. In such a way, diabetic patients can have a proper healthy Ramadan. And number 3, the third D which I didn't speak yet is the daily activities. The diabetic patients' daily activities, people more and more they ask about the daily activities. They can have mild to moderate activities. That means they can go and work as usual in their working environment. They should only refrain from hard physical labor. If they are a hard physical laborer and a diabetic, it is very difficult for him to fast, and there is a high chance that he will go into hypoglycemia. But in normal people, in general, the people, they can have a mild to moderate activity. The daily activities can be done without any problem. They should refrain from sleeping a lot. Another question patient asks is whether they will lose weight during Ramadan and whether it is healthy or not. Generally, research proves that during Ramadan, patients reduce only about 3 to 4 kilogram maximum weight loss. And they regain within another 1 or 2 months, they regain the same weight. In diabetics, especially type 2 diabetics and who are obese, it is advisable, it is good that if they lose some weight because they have insulin resistance, because their insulin cannot act on the peripheral tissues. Therefore, losing around 3 to 4 kilogram of weight is of good benefit, and they should not think it has a harmful effect. I hope that I covered main aspects of the diabetic management during Ramadan, and I hope that it would have been of much benefit for you all. Assalamu alaikum wa rahmatullahi wa barakatuhu. Allahumma salli ala Sayyidina Muhammadin wa ala ali Sayyidina Muhammad.